Recording? Okay, perfect. Okay, hello everyone. My name is Dominique Flores, and I recently passed my 1-year anniversary of working as a pediatric nurse this past August. And I have to say, it's been one heck of a year thus far. So here's my story. In the early stages of COVID, my hospital facility originally assigned the adult units to take care of the COVID-19 patients. But as each day passed by, we were alarmed at the rate the census was climbing, and with all the constant changes. There was always something being updated on a day-to-day basis as to how the influx of patients were going to be managed. And being from New York and New Jersey, we were hit the hardest and the earliest in the first wave. It started out by adding in additional interview questions to patients and visitors about their travel history, exposure, any experiences with certain symptoms, or to at least watch out for, to the implementation of visitor restrictions. The PPE shortage made things quite difficult, especially because we saw it quickly affect our medical supply chain as to where the resources were being directed towards when we needed it for our patients also. And the mass hysteria of hoarding supplies from grocery stores and Amazon didn't make the situation any easier when parents started to take PPE from our isolation carts as well as hand sanitizers from the unit clerk's desk. It was fairly exhausting and confusing on our end, not to mention feeling like the bad guy having to tell parents about the visitor restrictions for their child and how we can't let them take any mask or hand sanitizers for them. But we've learned to adapt and grow through that process. On March 11, the World Health Organization officially declared COVID-19 as a pandemic. And as the growing number of confirmed positive patients continued to flow into the hospital, it ultimately came down to the decision that 3 out of the 4 units of the pediatric department had to convert to COVID-19 ICUs. All of our patients were to be transferred to CHONI, and we said goodbye to our last pediatric patient on March 28th. Not knowing when we would ever get our kids back. Although we are considered a pediatric med-surg unit, majority of our census is comprised of hemoncers who are immunocompromised. So imagine going to work having taken care of kids with cancer only to be told that we needed to convert into COVID-19 frontline nurses. We were concerned not only about the exposure, but if we were knowledgeable enough to take care of severely ill and high acuity patients that were completely out of scope of the specialty that we've been working in. Ideally, and depending on your facility's program, new grad ICU nurse residency orientations can last up to 6 or even 9 months plus until you're considered competent enough to take on your own assignment. But we didn't have that kind of time. And time waits for no one. Certainly not at the brink of death. All the staff nurses in my unit had roughly 2 weeks of orientation to adult ICU nursing care. We had a couple of classes on ventilators and respiratory equipment, peritoneal dialysis, CRT, ICU continuous infusions for like vasopressors, sedation medications, and drips. I had about 2 shifts in the step-down unit and 2 shifts in the MICU and SICU combined. And already on my first day of orientation, I had my first post-mortem case. I'm not the type to complain. I truly want to see this as an opportunity to expand my nursing skill set going into the ICU and to contribute to the pandemic in a positive way as a frontline worker, because there was definitely a need for staffing. However, there were still some lingering thoughts in my head about what will be required. And in dire times, you'll be surprised at what you're capable of under pressure and immense focus. I've learned so much in so little time, but I have to attribute it all to the more experienced senior peds and PICU nurses who have been my rock throughout this entire time, as well as the adult MICU and SICU nurses who were a wealth of knowledge throughout the orientation. But the learning process never stopped there. Even after orientation, we were still learning things about the patients as we started to take on our own actual assignments about their coagulopathy, multi-system organ failure, their incidence of strokes. I can go on and on. And the beginning was rough. We were seeing deaths on days and nights. So while the rest of the world was watching our numbers rise, reading about bodies being stored in trucks and makeshift morgues, hearing how hospitals were running out of ventilators and ICU beds, we as the first frontline nurses were learning as we went, trying our hardest to save who we can with what we got. And over time, there was all this recognition for healthcare providers and frontline workers, which was really nice. It almost seemed a little bit too good to be true at times. The additional PPE supply support from nonprofits and grassroots organizations, nearby restaurants generously giving food to us throughout the days and nights, as well as donations of self-care goodies from companies were also heartwarming and endearing. But even with all the love and the recognition, I still clearly remember the feeling of being so restless in the early weeks of COVID. And I would be lying to say that I felt good about leaving work after giving a report to the day shift nurse, because I kept wondering if I really gave it my best. I still wonder about how the patients did once I left. And it followed you, no matter how hard you tried to detach. I found myself spending my off days researching ways I could possibly contribute in a different manner. Reading articles about the latest clinical trial medications, checking for diagnostic lab values to flag, looking into the most updated clinical nursing practices and treatment protocols, because there was comfort in knowing at least something or having a foundation in the patient care required. One of the things about nursing is that the way the majority of us cope with being able to take care of patients in their worst times is to be able to dedicate time for self-care, personal interests, and have a world outside of the hospital. But how could we detach if everything about life and the way the world worked around us was flipped, on top of seeing the same cases every day and patients dying? I started to see a pattern and the demographics of the people that this affected, and it makes you wonder about the chances, God forbid, that someone you cared about or someone you know becomes affected. And this was when I came to the realization that our healthcare systems need to change. And it requires taking action beyond the bedside. The racial and ethnic healthcare disparities were certainly apparent from our end. But along with having an understanding of the clinical situation, the physiology and science, we have to take into consideration healthcare policy, global and population health, preventative measures, lifestyle and cultural practices, tech and innovation, and the biggest elephant in the room, the business of healthcare. I have to say that it would be thanks to COVID-19 that my life changed forever, as I started to venture on exploring other aspects of healthcare that are intertwined and prompted me to participate in various health hackathons. My first competition was with MIT's hackathon Beat the Pandemic, where I collaborated with a diverse team of working professionals in epidemiology, computer science, pharmacy, chemical engineering, data and material science, to give a pitch on healthcare data collection and extraction software of key clinical data for confirmed COVID-19 patients that could be utilized to create clinical trials. I can say that since June, we got our pediatric patients back, and looking at those 3 months, time really felt like it was going slowly, where the days felt like weeks and the weeks felt like years. It's September, and honestly, April feels like it was about a decade ago. And more than anything, I so deeply wish that we could resume back to times of normal socialization where we didn't have to worry about distancing precautions, or with the overlooming fear that whoever we encounter or meet up may be infected. And worst case scenario is that either we get sick or we pass it on to a loved one who is more vulnerable than we are. Research still needs to be done, and more or less we still need a confirmed working vaccine in order for any progress to be made. A lot of work needs to be done, and our healthcare models do need to change. But you have to admit that if it weren't for the coronavirus, the changes that we're talking about that need to be made were actually already pre-existing problems that were exacerbated, that probably would not have been brought to light or to our awareness if it weren't for this situation. 2020 may not have been what we planned it out to be, but life happens when we're busy making other plans. And the one thing I can say for certainty is that 2020 is indeed the year of the nurse. We got the chance to show the world what it is that we do, what it means to excel, to lead, to innovate, and to be world healers. Thank you.